the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Health Care, where people are the heart of our business. All County Health Care is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome, South Florida residents. This is Lou Biazzi with All County Healthcare. We have a very, very special guest tonight, a very unusual physician, and I believe we have Dr. Rodrigo Aragons. Am I pronouncing it right, Doc? Aragons?
Pronounced Aragos.
Aragos. Right. Doc, he's a specialist in one thing. He's a specialist surgical oncologist. Tell us what that means, Doc. What's a surgical oncologist, and what do you actually do?
Well, a surgical oncologist is a subspecialist that dedicates his career in managing cancer patients. Part of the training is to become a general surgeon first, and then you do another extra training in complex surgical oncology, which entails the management of cancers in different parts of the body.
Mm-hmm. I understand one of the things, I had a secretary that came down with a disease, an orthopedic cancer, and we went down to the University of Miami, and there's very few people that treat orthopedic cancer as an oncology. You had to have an orthopedic oncologist. So in your practice, it's a specialty practice, I'm assuming, that you treat specific cancers. Am I correct?
Correct. I'm subspecialized in the treatment of breast cancer, so I'm a breast surgeon, and as well a head and neck cancer. Within the head and neck cancer field, I'm subspecialized in the treatment of thyroid diseases and parathyroid diseases as well.
Both benign and malignant, right?
That's correct.
So now you got quite a history as far as your education goes. Tell us a little bit about your education.
Well, I performed my general surgery training at Michigan State University, where I was named chief resident as my chief year, which is the 5th year of general surgery training. After that, I had the privileges to go to Fox Chase Cancer Center in Philadelphia, where I did my fellowship training in surgical oncology as well as head and neck cancer. Fox Chase got me a sponsorship to perform my master's in clinical research for healthcare professionals at Drexel University. And after that, I did a new fellowship that is out of the International Federation of Head and Neck Oncology Societies and Memorial Sloan Kettering in head and neck as well. And after that, I practiced as a surgical oncologist, subspecialist in breast cancer and in head and neck cancer in Mexico for 6 years. And I just decided to come and continue my practice here in Miami, and I've been practicing here for half a year now.
Half a year, and you got quite a set resume because you graduated summa cum laude too in one of these schools. Am I correct?
Yes, my medical school training, I graduated summa cum laude as well.
Summa cum laude, not cum laude, summa cum laude. So you should really be proud of that situation. There's not too many summa cum laude doctors around this area. Now, Doc, let me ask you a question. Yes, are you in private practice also? Or are you with Tenet?
I'm with Tenet Healthcare Physicians, and within Tenet, I'm within a group that's a subspecialty group that's called Center for Advanced Surgical Oncology. Currently, we're 4 partners within the group, and each of us dedicates our career to managing different types of cancer.
Now, you can accept patients that will call you. They can call you and set up an appointment if they have a problem, something similar to with your treatment of your diseases, so they can set up an appointment with you. Correct, Doc?
Correct. Many patients can call directly, and some patients need to be referred by their primary care physician or endocrinologist, internal medicine doctor, or a medical oncologist or radiation oncologist, and they're the ones who make the referral.
Now, how would they get in touch with you? What is your phone number of your office?
The phone number to my office, well, we are based out of Palmetto General Hospital. That's our base campus. And our office number is 305 820-6657.
So,
you want me to repeat
Freddie,
it?
would you put that on the screen? Say it again, please. 305
820-6657.
820-6657. So if any of you people out there are suffering from some of these ailments, whether it's benign, whether you think it could be benign or you think it could be cancerous, my suggestion is you call this young man, and he is a young man, and he's got quite a history, and he will make arrangements to see you. As he said, he's been in this area for 5 months already, Doc? 5 months?
Oh, more than 6 months now.
More than 6 months now. So his practice is growing. He was referred to us by David DePino, who works with Tenet, and he's an up-and-coming oncologist, surgical oncologist, which is very, very hard to find. It's a very specialized field, I'm assuming, Doc. Am I correct?
Yes, it's one of the subspecialties within general surgery. It's difficult to get into the surgical oncology fellowships here in the United States. But it's growing, and I think today cancer should be managed by subspecialties.
Okay, so when my secretary had that problem, they told us there was only like 2 of those orthopedic oncologists in the whole area. Now, how many would you say, in your practice, how many people specialize in your specialty group with your profession? Would you say there's a number of surgical oncologists that do what you do, or just a limited amount?
No, I think it's growing. There are more subspecialties within this field. So I think there's a lot of breast surgeons around. There's a lot of head and neck surgeons around. And it depends. It's also in what area of the country you're in. The big cities usually have more subspecialties than in smaller rural areas. And for example, you were talking about orthopedic oncology. That is a very rare disease, so there are not a lot of orthopedic oncologists around.
Right.
That's a limit in the field compared to general surgical oncology, which it's been growing that field. And there's in every big center, you're going to find surgical oncologists, and surgical oncologists that subspecialize within different types of cancers in the body.
So if the patient comes to see you, you follow the patient right through as far as from surgery or even on to oncology, correct? When you supply,
as a surgical oncologist,
do you supply?
Well, as a surgical oncologist,
Go ahead. I'm sorry. Go ahead. Tell us what the surgical oncologist does.
You participate in the diagnostic process, in the therapeutic management, which could be surgical or non-surgical. Today, cancer is managed in a multidisciplinary fashion, which includes the surgical oncologist, which will be the surgeon, the medical oncologist that gives chemotherapy, endocrine therapy, or hormonal therapy, or immunotherapy nowadays, the radiation oncologist, which gives radiation therapy. There are various types of radiation that can be given. There are the radiologists that specialize in seeing CT scans, mammograms, MRIs of the breast or other parts of the body. There are physical therapists that do the rehabilitation. For example, in breast cancer, when you do X-ray dissection, the patient can get a complication called lymphedema. So you need to have them involved. In head and neck cancers, when you have to resect the mandible or the larynx and they need rehabilitation to learn how to speak or learn how to swallow. So that's part of the entire team that is involved in the management of breast cancer patients. The plastic surgeon that does the reconstructions also is part of the cancer group that take care of these patients.
So you're involved with that whole group. You're part of that whole group that determines what the patient's going to get. Am I correct?
Correct. I'm part of the group. For example, in our group, all of our patients are presented in a tumor board that The participants of this tumor board include all subspecialties within the oncologic field and GI field. And once we decide what to do, what's the best option for the patient, we must remember that today cancer, it's managed in an evidence-based fashion, but as well as an individualized fashion. We individualize care to the patient based on evidence that's out there. So the patients are presented in a tumor board, and the whole team decides what's the best option for that patient.
Right. One of the things I notice is one of the things your specialty is too is that you're bilingual, both in Spanish and
Correct.
English. Am I correct? So if
I'm
you have a
fluent in
Spanish
both
patient,
Spanish and English.
so Spanish and English, fluent in both. So
Correct.
primarily, if you have people in Palmetto, you're down there in Palmetto General Hospital, which is part of Tenet. Am I correct? Palmetto is
Correct.
part of Tenet, correct? All right. That's
Yes,
and where's
it
that
is.
located, Doc? Where is that
It's located
located?
in
Palmetto.
In Hialeah.
In Hialeah, which is
Yes,
predominantly a Spanish area.
Correct. Yes.
Okay. So now, what do you take all insurances? You take Medicare? What are the insurances you'll accept? Do you get involved with that at all?
Yes, I do not directly, but we do accept all insurances.
So you accept all insurances. So if the person
Correct.
has a managed care or they have a Medicare or whatever question, they still have the opportunity to come and visit you and see you.
That's correct.
Okay. So folks, again, you find Dr. Rodriguez. You can find him, Rodrigo, at Palmetto General Hospital. The phone number again, Doc. Would you give it again, please?
Yes, it's 305-820-6657.
The reason why I asked you for the phone number, because this hits 3 million people, Doc, in the course of a week. That means people
Okay.
in Canada, it's on iHeart. So people come from all over, and they'll listen to this program during the whole course of the week. And if they know this is what your specialty is, they might come. We had patients that called from Canada to set up appointments with physicians that were on our show. So you might get a call from Canada, you might get a call from some other part of the country that they'll want to come and see you. Because, again, as I said to you, with your background, anybody should want to come to see you because there aren't too many summa cum laude oncologists out there. We're going to take a 30-second break right now, Doc. We'll be right back, okay?
Okay, I'll be here.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back, Doctor. And again, let me ask a question. Everybody, when they hear the word cancer, right away they immediately get scared, they're frightened, they think it's a death sentence. In your field today, are you seeing a lot more curable cancers that can be cured? What do you think the rate of survival rate would be in your field?
Well,
If that's a crazy question to ask.
It depends on the stage that we diagnose. I know that we're diagnosing more cancers because more patients or more people have access to medical care, and they're getting tests performed for a lot of reasons other than looking for a tumor. And incidentally, they identify a tumor therapy for the different types of cancer. For example, breast cancer, which I'm a breast surgeon. We know that in the last couple of years, the therapeutic regimens that we have to treat breast cancer have improved significantly, and that has improved in the survival of patients. But like always, it depends on what stage we diagnose the cancer. And also, we know that people are living more today than they did 50, 60 years ago. And like a car, the older it gets, the more parts that start failing, and that's the human body as well. So we're diagnosing more cancers.
I know that, Doc. I know that. I'm getting up there too myself. So go ahead. Now, another. I don't mean to interrupt you, but another question I got to ask is, how would a person know if he had this problem? It could be a thyroid, or what are some of the symptoms they might have?
For example, if we talk about thyroid diseases, today, the most common way that we identify a patient with thyroid cancer is that they get an ultrasound of the neck performed for other reasons. A swelling of the neck, the physician feels that the patient has swollen glands, or for another specific reason that is not thyroid in origin, and they identify that the patient has a thyroid nodule, which is a relatively common thing. I can tell you that about 5% of women have palpable thyroid nodules, 1% of men have palpable thyroid nodules. But if I perform ultrasounds to patients haphazardly in a mall, for example, 19% to 68% of them will have thyroid nodules. But not all of them are malignant. On the contrary, the vast majority of thyroid nodules are benign. Approximately 7 to 15% of thyroid nodules are malignant. So I have to be very specific which patients I'm going to do a workup and submit them to costly procedures, invasive procedures. So there are specific criteria that came out by the American Thyroid Association or by the National Comprehensive Cancer Network that helps me identify which patients I have to follow, which patients I can just tell them they don't have to worry about the nodules, or which patients I have to perform a biopsy. That today, the most frequently performed biopsy for thyroid nodules is a fine needle aspiration. And it depends, the criteria depends on the size of the thyroid nodule, the characteristics of the thyroid nodule, the shape, its borders, its vascularity, if it's taller than wider, if it has calcifications or not. And depending on that, I make a decision in which patients I need to follow or biopsy.
Okay. Now, how could a patient self-examine herself if she thinks she has a problem? Is there any symptoms like diet? Or I know a friend of mine, she went in and the doctor was checking her. They found a lump in her neck. She ended up having cancer of the uterus with a lump in her neck. That's what he found out. Okay. So I guess a lump in the neck can determine a lot of other diseases too.
Correct. If you have a swollen lymph node in the neck, it could be anywhere from the head and neck region to the gastrointestinal tract, genitourinary tract. It's difficult. It's difficult, but I think one way to make sure that you're healthy and you don't have an abnormality going on in your body is following up with your primary care physician as you should, and having a thorough history and physical exam performed every year if you're over 30 or 35, with lab work performed, and based on what the primary care physician identifies, getting adequate referral to the subspecialties that deal with this type of diseases or cancers.
Okay, so in other words, you find that most of these thyroid problems occur in females. Am I correct? More than males?
Yeah, a rate of 7 to 8 to 1. That doesn't mean that men do not get thyroid cancer or have thyroid problems like hyperthyroidism or hypothyroidism, but it's a disease that is more common in women than in men today.
Does it affect their eating habits? Does it affect their weight? Does it affect anything? Some people say they get very depressed. Does the thyroid cause depression?
If you have abnormal functioning thyroid, yes. For example, if your thyroid gland is hypofunctioning, it's not producing the thyroid hormones, what's going to cause this is that you're going to be hypothyroid. By being hypothyroid, one of the symptoms that you might get is depression or altered emotional status. Patients get tired easily, fatigued, they speak slower, they think slower, everything slowed down. You remember the thyroid gland is the metabolic organ of the body. So yes, to answer your question, they could get depressed if they have thyroid problems.
Is it caused mainly when women are going through what they call a change of life or something? Is that at a certain age? What age should women look at this, or men should be looking for thyroid problems? Where is the thyroid located? what is the function of the
Excuse me?
thyroid? What is
The
the
thyroid
function?
gland okay, the
If that's a
thyroid gland is located in the neck, in the lower part of the neck, in the midline. It sits around the trachea and the larynx. The main function of the thyroid gland is the metabolic organ of our body. It produces thyroid hormone, T4 and T3, that regulate many aspects of our metabolism and temperature. So when it's not functioning properly, it produces a vast array of symptoms, depending if it's hyperfunctioning or hypofunctioning. Part of the team that deals with thyroid problems is the surgeon that operates when it's required. Either, for example, when you have a very large thyroid gland that is producing symptoms, when you have a very hyperfunctioning thyroid gland in a disease state called Graves' disease. And one of the options of the management is surgery. Not all the time. The vast majority of the time, you can treat Graves' disease with radioactive iodine, but sometimes the surgeon has to get involved. Or when there are thyroid nodules that are cancerous, or there's a high suspicion of cancer, that's when the thyroid surgeon or the endocrine surgeon gets involved. But the medical aspect, the endocrinologist deals with these diseases. For example, when you have a hyperthyroid patient or hypothyroid patient that is medically managed, the endocrinologist treats that.
Do you find that this problem is becoming more prevalent today in today's society with everything we have, or is it something being more diagnosed more frequently? Thyroid problems?
I think it is. For example, in my field, we're diagnosing thyroid nodules more and more because we're doing imaging studies, CT scans, MRIs, ultrasounds of the body for different other reasons, and we identify these thyroid nodules. So that's why we have to be very selective in which patients we have to do a complete workup, because if not, we're going to be doing a lot of tests. Some of them are invasive in patients that have benign disease. So that's why a subspecialist needs to evaluate the patients and decide if further workup is required or not.
Doc, I can't thank you enough for this interview, because I tell you, it's you made me very, very knowledgeable about thyroid diseases for men and females, because I hear a lot of my friends tell me, well, they had a thyroid problem, and I just shrug it off. I don't even know how serious a thyroid problem could be. But apparently, if you have a thyroid problem, or you do have you think you have breast cancer, my suggestion is you go see doctor. Doctor, again, give me your phone number, please, so we can have it on the so people can have it.
Yes, sure. It's 305-820, and 6657.
305-820-6657. Am I correct?
Yeah, that's correct.
Please put that down, because if you do have any of these conditions, he's willing to see you. He's just into the area. We're very, very fortunate to have him in the South Florida area. I mean, as you can see, he's a young, handsome doctor, willing to, take on any case that you have that you might have. Doc, again, they're giving us a signal we must leave. Let's have you back again, okay, Doc? Thank you so much for coming. Thank you. Have a nice holiday.
Thank you. Thank you. You too. Take care.
Stay healthy. Bye.
You too. Bye-bye. Bye.
Bye.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having